Have you ever pondered what happens when your heart can't keep up with the demands of your body? This is not a scenario from a science fiction novel, but a reality for millions of people dealing with a condition known as congestive heart failure. Congestive heart failure, as the name suggests, is a medical condition where the heart struggles to pump enough blood to meet the body's needs. It's not an independent disease, but rather the end result of other conditions that have damaged or overworked the heart muscle. This is more common than you might think. Approximately 6.2 million people in the United States alone are living with this condition. That's roughly the same as the entire population of Tennessee. To understand the severity of this condition, we need to talk about something called ejection fraction. It's a term that sounds like it's straight out of a physics textbook, but it's actually a measure of how well your heart is pumping. Specifically, it refers to the percentage of blood that's pumped out of your heart each time it contracts. In a healthy heart, this figure ranges from 55 to 70%. But in someone with congestive heart failure, the ejection fraction can be significantly lower, indicating the heart's struggle to supply the body with enough blood. So when we talk about congestive heart failure, we're dealing with a complex condition that varies greatly in terms of symptoms and severity. As we delve deeper, we'll discover that symptoms and severity can range greatly, making this a complex condition to understand. What triggers the heart to falter in its vital duty, and how does the body respond? An intriguing question indeed. Let's delve into the causes and symptoms of congestive heart failure. Congestive heart failure can be triggered by several underlying conditions. Coronary artery disease is a common culprit. This condition narrows the coronary arteries, reducing blood flow to the heart, which can weaken or damage it over time. Heart attacks are another leading cause. They occur when a blocked artery prevents oxygen-rich blood from reaching a section of the heart. If the blockage isn't cleared quickly, the section of heart muscle begins to die and is replaced by scar tissue, which can lead to heart failure. But what about the symptoms? How does our body react when the heart struggles to fulfill its vital role? Interestingly, symptoms can vary greatly depending on the level of heart failure. In some cases, individuals may only experience symptoms during strenuous activity. This could be anything from shortness of breath, fatigue, and rapid or irregular heartbeat to swelling in the legs, ankles, and feet due to fluid retention. In severe cases, these symptoms may even occur at rest, signaling a more advanced stage of heart failure. There are also more subtle signs that shouldn't be ignored. People with heart failure often experience a persistent cough or wheezing, as fluid builds up in the lungs. There may be an increased need to urinate at night, and some may notice a lack of appetite or nausea, as digestive system receives less blood, causing feelings of fullness or indigestion. In essence, our bodies send us various signals when the heart is faltering in its duty, from the overt signs of fatigue and breathlessness to the subtle cues of a persistent cough or loss of appetite. Recognizing these symptoms can be crucial in the early detection and treatment of congestive heart failure. Our bodies send us signals, and understanding these can be the first step towards managing the condition. So, let's keep our hearts in check and pay attention to the signs it provides. After all, knowledge is the first line of defense. Are some of us more prone to congestive heart failure than others? And how do medical professionals diagnose this condition? Let's delve into this. Certain underlying conditions and lifestyle choices can indeed heighten the risk of congestive heart failure. Coronary artery disease, high blood pressure, and diabetes are a few such conditions. These illnesses can overwork and weaken the heart, paving the way for heart failure. Lifestyle factors also play a significant role. Unhealthy habits such as smoking, excessive alcohol consumption, and a diet high in fats and cholesterol can negatively impact heart health. Lack of regular physical activity is another risk factor. Obese individuals in particular are at a higher risk due to the extra strain on the heart to pump blood throughout a larger body. Now that we've discussed risk factors, let's explore the diagnostic process for congestive heart failure. Diagnosis begins with evaluating symptoms. These symptoms can range from fatigue and breathlessness during exertion to swelling in the legs, ankles, and feet. Sometimes even symptoms as subtle as a persistent cough or rapid weight gain from fluid retention can be indicative of heart failure. The next step in the diagnosis involves a thorough review of the patient's medical history. Doctors consider factors such as age, family history of heart conditions, and the presence of any underlying conditions we mentioned earlier. Following this, a series of tests are conducted to confirm the diagnosis and assess the severity of the condition. These tests can include blood tests, chest X-rays, echocardiograms, and stress tests, among others. Each provides critical insights about the heart's function and the extent of its inability to pump blood effectively. In essence, understanding these risk factors and the diagnostic process is the first line of defense against congestive heart failure. Knowledge of our vulnerabilities and the diagnostic process can empower us to take charge of our heart health. What can be done to slow down the progression of congestive heart failure and reduce symptoms? It's a question that many ask, and fortunately there are several treatment strategies available. First, let's talk about medication. Several types of medication are commonly prescribed for congestive heart failure. These can include ACE inhibitors, which help blood vessels relax, and beta blockers, which slow the heart rate and reduce blood pressure. Other medications, like diuretics, can help reduce fluid buildup in the body. It's important to remember that medication needs can vary greatly from person to person, so it's crucial to work closely with your healthcare provider to find the right regimen for you. Next, lifestyle changes. Healthy habits can have a significant impact on managing congestive heart failure. This can mean adopting a heart-healthy diet, rich in fruits, vegetables, and whole grains, while limiting sodium and alcohol. Regular physical activity, as advised by a health professional, can also be beneficial. Additionally, quitting smoking and managing stress can contribute to better heart health. Surgery is another treatment option, typically considered when other treatments aren't enough. This can include procedures like heart valve repair or replacement, coronary bypass surgery, or even heart transplants in severe cases. These procedures aim to correct underlying issues causing the heart failure. Lastly, let's not forget the importance of regular communication with a heart failure specialist. This can improve outcomes by ensuring that the treatment plan is tailored to the individual's needs and adjusted as necessary. Regular checkups allow for monitoring of the condition and timely adjustments to the treatment plan. In short, treatment for congestive heart failure involves a combination of medication, lifestyle changes, potential surgical intervention, and regular consultation with a specialist. While it's a serious condition, there are strategies to manage it and maintain the highest possible quality of life. What does the future hold for someone with congestive heart failure, and can we prevent it? This question undoubtedly weighs heavily on the minds of those affected by this condition. Let's delve into the survival rates and prevention strategies for congestive heart failure. When we talk about survival rates, it's important to understand that these figures are not set in stone and vary greatly depending on several factors. For instance, the severity of the condition plays a significant role. Statistically speaking, it's estimated that between 55 to 65% of individuals with end-stage heart failure survive after 1 year. This might sound alarming, but remember, this statistic is for those with end-stage heart failure, the most severe form of this condition. Now let's pivot to prevention. It's crucial to manage risk factors and comorbid conditions to prevent or manage congestive heart failure. This involves taking a proactive approach to your health. It's about regular communication with your healthcare provider, keeping them informed about any changes in your symptoms, and sticking to the treatment plan they've outlined for you. But it doesn't stop there. Prevention also includes adopting a healthier lifestyle. This means eating a balanced diet, getting regular exercise, maintaining a healthy weight, and quitting smoking if you're a smoker. And let's not forget about managing stress. Chronic stress can take a serious toll on your heart, so finding effective stress management techniques is crucial in preventing heart conditions. In essence, prevention is about making conscious, healthy choices every day. It's about taking control of your health and not letting it control you. While the statistics may seem daunting, remember that prevention and early intervention can significantly alter these figures. The power to change the course of your health lies in your hands. So, take charge, be proactive, and remember, every step you take towards a healthier lifestyle is a step away from congestive heart failure. Now let's address some common queries that many people have about congestive heart failure. One of the questions we hear often is, can you live a normal life with congestive heart failure? The answer is, it depends on the severity of the condition and how well it's managed. Many people with congestive heart failure continue to lead fulfilling lives by making lifestyle changes and following their treatment plans diligently. Regular checkups with a heart failure specialist also play a major role in managing the condition effectively. Next, you might wonder, what are the early warning signs of congestive heart failure? Early signs can be subtle and may include shortness of breath during routine activities, rapid weight gain due to fluid retention, and noticeable swelling in the legs, ankles, and feet. Fatigue, increased heart rate, and persistent cough or wheezing could also be indicative. Remember, these symptoms could be signs of other health issues as well, so it's always best to consult with a healthcare provider for an accurate diagnosis. How long can you live with congestive heart failure is another question we hear quite often. The survival rates can vary widely depending on the severity of the condition, underlying health issues, and how well the condition is managed. On average, about 55 to 65% of people with end-stage heart failure survive after 1 year. However, every individual's journey is unique, and advancements in medical treatments continue to improve these statistics. Moving on, what is the best treatment for congestive heart failure? Treatment plans are personalized based on the patient's specific condition, severity of symptoms, and overall health. The options could include medications to manage symptoms and slow the progression of the disease, lifestyle modifications such as dietary changes and exercise, and in some cases, surgery or medical procedures may be recommended. Lastly, can congestive heart failure be reversed? While the damage to the heart muscle can't be reversed, treatments can significantly improve symptoms and the quality of life. Furthermore, managing risk factors and comorbid conditions, along with maintaining a heart-healthy lifestyle, can help to slow down the progression of the disease. Remember, knowledge is power. The more informed you are, the better equipped you will be to handle this condition.